Hi everyone. Protozoal diseases are diseases caused by Plasmodium species. Plasmodium species are unicellular protozoans. Diseases include malaria, amoebic dysentery, leishmaniasis, microsporidiosis, toxoplasmosis, etc. Of these, three important diseases like malaria, Kala-Azar, and toxoplasmosis are discussing here. Malaria is a life-threatening disease. It's really transmitted through bite of an Anopheles mosquito. Its infected mosquito carry their plasmodium parasite when this mosquito bites you. The parasite is released into your bloodstream. There are mainly four kind Plasmodium species: Plasmodium ovale, falciparum, vivax, and Plasmodium malariae. Of these, Plasmodium falciparum is dangerous one, and those with this form of malaria have a high risk of death. An infected mother can also pass disease to her baby at birth. This is called congenital malaria. Then malaria can also transmitted through blood transfusion, organ transplantation by sharing needles used to inject drugs. Its signs and symptoms appear after 48 hours. It include fever, abdominal pain, discomfort, nausea, vomiting, etc. Sometimes blood leak out, child become weak and unconscious, even death will occur. These loss of RBC result anemia. Second one is Kala-Azar. Kala-Azar is also called visceral leishmaniasis. Is a potentially fatal disease. 30% cases in world occur in India. It is spread by the bite of an infected sandfly attacked on immune system and is almost always fatal if left untreated. 80% of cases occur in Bihar. But Kala-Azar cannot eliminated from India without its addressing co-infection with HIV. When a person is said to be co-infected, two infection at same time. Its symptoms include PKDL. PKDL is the main symptoms of Kala-Azar is a post-Kala-Azar dermal leishmaniasis. It's a complication of visceral leishmaniasis, and it is characterized by nodular rashes in a patient who has recovered from visceral leishmaniasis. Other symptoms are recurrent fever, loss of appetite, weakness. Then person show grayish discoloration of skin of hand and feet. Then these parasites enlarge spleen and liver when they occupy on macrophages. It change form and multiply and invade all organ, especially spleen and liver. In Asia, it is called black fever because skin often darkens. Third one, toxoplasmosis. Toxoplasmosis is a condition caused by Toxoplasma gondii. They are single-celled obligate intracellular species. They can get inside a cell and reside there. It is a worldwide distribution. So, its main hosts include cats and livestock. Here, mice act as an intermediate host. So, actually, a person get these condition by being exposed to cat feces, oocyte, etc. Vertical transmission also here, that is a newly infected pregnant woman passing the infection to her unborn fetus. It is called congenital toxoplasmosis. When acquired toxoplasmosis, what is acquired toxoplasmosis? That is acquired during a lifetime in adult. When a person eat undercooked meat, for instance, this would be acquired. Its signs and symptoms include some people cause toxoplasmosis show no signs. Some cause cervical lymphadenopathy, that is lymph node swellings. It also include constitutional symptoms like fever, fatigue, etc. Congenital toxoplasmosis is a cognitive impairment. That's why it's important for pregnant women to avoid risk factors for getting toxoplasmosis. Researchers show that in a patient with acquired toxoplasmosis exposed later in life decrease their cognitive functioning. When protozoa get into muscle of patient, so they can reside in the muscle cells, enter into liver and reside there. But they are also known to cross blood-brain barrier and get into brain tissues and affect our cognitive function. This decreases processing speed. That means they if they try to do cognitive tasks, they are slower than a patient who has no antibodies against toxoplasmosis. Patient with antibody also have decreased their working memory. Short-term verbal memory also occur. So, beware of these dangerous diseases like malaria, kala azar, and toxoplasmosis. Thank you.